Okay, everyone, I'm going to get started because we're a couple minutes late, not too late. But before I introduce today's speaker, which I'm very excited to hear from Rulan, I want to give our land acknowledgement, which is that we recognize that we live, work, play, and participate in a community on the unceded, ceded, and traditional territories of the 203 First Nations, along with 38 Métis chartered communities, each of which possess their own unique traditions and history here on this land that we now refer to as British Columbia. We acknowledge we acknowledge the importance of the Truth and Reconciliation Commission of Canada's call to action, the United Nations Declaration on the Rights of Indigenous Peoples, and the BC Declaration on the Rights of Indigenous Peoples Act. In all of our work, we are committed to ensuring Indigenous women's rights to health and safety and the equal opportunity to participate in a manner that recognizes and respects Indigenous cultures and traditions. And today I'm joining you, I'm actually joining you from Toronto, but I'm going to pretend that I'm in Vancouver, which is because that's where the Women's Health Research Cluster is housed, which is part of the unceded homelands of the Coast Salish peoples, the Musqueam, Squamish, and Tsleil-Waututh First Nations. And I will very, very briefly, this is brought to you by the Women's Health Research Cluster. We have many members, over 400 members representing 18 countries. We have a number of events like the seminar series. We have a fantastic conference going on right now, which is on hormonal contraceptives and how they affect the brain. So please join that if you'd like. There's blogs, there's podcasts, there's travel awards for trainees. And if you like the work, please do support it. And with that, I'm going to stop sharing so Dr. Parekh can share her screen, and I will give the bio and her fun fact, which I cannot wait to tell you all. So Dr. Rulan Parekh is a vice president academics at Women's College Hospital, a staff nephrologist at Women's College Hospital and the Hospital for Sick Children. And she's also a professor of pediatrics and medicine in the departments of medicine, pediatrics, epidemiology, and health policy and management evaluation at the University of Toronto. That is a mouthful. Those are a lot of hats you wear. Dr. Rulan Parekh is a clinician-scientist and an international leader in clinical epidemiology and translational research in kidney disease. Her work has revealed novel genetic risk factors leading to kidney disease and increased risk of cardiovascular morbidity and mortality for children and adults with kidney disease. Dr. Parekh previously held a Canada Research Chair in Chronic Kidney Disease Epidemiology and now holds the F.M. Hill Chair in Health Systems Solutions. And I know Dr. Parekh fairly well, but being on committees with her on the Partnership for Women's Health Research. Always a joy. I love listening to Dr. Parekh. She always has so many great insights. So I'm really excited to hear what she has to say because I need some ammo for people who say that it should always be based on meritocracy and the status quo. And so I'm very excited to hear what she's going to say. As you know, I like to give fun facts, and because we have some really fantastic researchers that give talks to us, and today this fun fact does not disappoint. Dr. Parekh was Frenchie in the High School musical production of Grease. The highlight was when she wore her blue wig for the musical piece. She got the wig at the Salvation Army and then spray painted it bright blue. And every time she went on stage, she had to wait for a few minutes until the audience calmed down because it's so hysterical. But I'm a tiny bit disappointed because you didn't wear the wig because I wore my bright blue jacket to match the fun fact today. Take it away.
Thanks so much. And in fact, thank you so much for inviting me. And I really look forward to talking to you guys some more. Can you see my main slide or are you seeing the display?
I can see your main slide.
Perfect. That's great. What I wanted to do to make sure today was that we had time to talk at the end. So my talk isn't very long because I was hoping to really generate some conversation because effectively I can tell you everything I found in like about one sentence, which I'll tell you all at the end, and then hopefully we can have a discussion about how to move forward. So through my journey, I realized, as I've been telling people, I've been in medicine for many years, and I've actually trained at multiple institutions, both in the States and in Canada, and where I've also practiced. But every single place I've been at, I've had to advocate for women in many different ways. So even though my class medical school class was probably 50% women, what I've noticed is that then when it came into residency, there were very few women that were here. And then when it came to actually advocating for more people in nephrology, when I did my subspecialty training, that was new. And then when I came and I joined science and I advocated for scientists, again, there were so few women. And so every single step of the way, I've always had to explain why it's important that there's women in science, that there's women and diversity in science, and that we deserve a seat at not only at the table, but we need to be really in the room where it happens. And so my hope today is I can show you how it's being biased towards women all of these years, but hopefully I think that we have some momentum to make some changes. What's also been interesting is that this isn't just a phenomena that's, within Canada. It's really a global phenomena that occurs everywhere. And representation of women in academic medicine, this came from the AAMC in the US, and you can see that medical school applicants were about 51%. So that's great. Medical school reflects the population at large. The number of graduates drops a little bit because the number of women may drop off due to family responsibilities. And then those who go on and stay within medicine to practice drops off a little bit more. Joining academic faculty, there's a drop off. And then you just get this complete drop off at division chief, full professors, deans, smaller and smaller numbers. So people talk about a leaky pipeline. And I don't think it's necessarily a leaky pipeline as much as sometimes there are choices that are made. And as many of you know, that there are biases in hiring practices and other processes going forward. So we have to kind of address this, because I think, why don't we all represent the 51% in every single one of those bubbles? What's also being seen in Canada, which I thought was interesting, was 57% of bachelor students. So most of these, and these are actually predominantly in science. So we started at a very high number, even greater than the 51%. And then as you drop, there's this constant chipping away at our numbers, to the point that, in fact, in 2011, no circs were actually held by any women at all. Tier 1 CRCs were 17.4% in 2012. And I will say, as much as people may complain about government, it wasn't until Justin Trudeau came in and said that the Canada Research Chair program had to change and address equity. And without having an ally to do that, it's doubtful that this number would have ever changed. And this is now changing, I think, quite considerably. And it's a much higher number, well over 35%. But we definitely have a way to go before we'd hit 51%. What I think has also been great is that, there are these two reporters of the Globe and Mail who've done this investigative research, and have really done it in every sector, but specifically for healthcare, when they take a look at either the hospital corporations or academia, 52% are women within these areas, but 50% are from diverse ethnic backgrounds, and 44% speak another language beyond English and French. This is just the city of Toronto. But then when you take a look at who makes up the city, in fact, you'll see that at the largest hospital corporations within the province, more than 65% of the presidents are male, more than 65% of the department chiefs are male, and more than 65% of division heads and research institute leadership are male. And so even though medical school has been equitable for a number of years, we continue to have this drop off. And there continues to be this gender divide here on the right, also seen among deans, professors, associate professors, and assistant professors. Again, this complete plateau. And the question is that happening because of the leaky pipeline that people are leaving? Or in fact, is it really because there have been systematic biases that have been introduced? When you take a look at underrepresentation of people of color within healthcare leadership, even within Canada, this was done, and there was poor racial diversity among healthcare leaders. Even though we talk about the diversity of the country, diversity in hospitals is not reflective of the communities they serve, right? And I think that's really important, and that you really should be representative of the group that you support. And so why is it important? Well, diversity has actually shown that it increases creativity and productivity, and I won't show you all the data to do that, but definitely has been shown in multiple reproducible studies, especially within the financial sector or the banking sector. Increase in scientists studying diseases that affect women and diverse persons actually would make sure that the more diverse people we have, we can actually study diseases that affect us. And as women, we want people to study women's health and women's brain function, as an example. And so that's something that we really want to go forward. Women build communities, networks, enhance collaboration. And really, we develop team science, and we do that naturally. And so that collaborative team science approach is really moving things forward in what I would say sort of research of the 21st century. And so increasing diversity in science is everyone's responsibility. And what I thought was important was the NIH director, Francis Collins, when he was there, he actually basically put out a statement that he would never participate in any more manels, and that it was really important that he actually advocated for why that was so important. And he actually was a keen ally. And he for she is another example. Again, having allies in this area is really important. One of the other things is, how can a profession that so highly regards merit and objectivity also produce outcomes that are unfair to many, many scientists? And what I'm hoping to show you is how we're trying to sort of understand what are the methods of assessing merit, and can we actually say that they are valid and reproducible? I give this story about Katalin Karikó because I think it's really important. You know, Katalin Karikó is the one who helped develop the COVID-19 vaccine and actually worked for BioNTech in Germany. But it's important to realize her story, in that Katalin actually received the Gairdner Award last year. But when I was lucky enough to meet her as part of the Gairdner, and really quite a remarkable story. When she came to the US, in fact, somebody tried to get her deported. When she tried to study RNA biology, they repeatedly told her that it was not going to work. When she tried to get a proper professor job, she actually didn't get it. And then, in fact, they repeatedly tried to fire her. And she was basically a glorified postdoc and research associate for many, many, many years, until the work actually came to fruition. BioNTech actually brought her over. She started working for BioNTech. And then she actually got the recognition that she deserved. They were working on cancer RNA biology. And then lo and behold, we have the COVID-19 pandemic. And suddenly, everybody wants to be able to develop a vaccine. And they were able to do it the moment that the SARS-CoV-2 was actually genetically sequenced. Once they had that, they were able to go straight onto the RNA biology using the techniques that she and actually another scientist in BC able to use his technology in order to envelop with lipid the RNA. And so then you're able to actually have an RNA target vaccine. So super exciting. She's now won at least 59 awards, including the Gairdner. And I think the question is whether she'll win a Nobel Prize or not. But what's important is, if you take a look at her benchmarks, she's never gotten an independent research grant as a recipient, as a PI. She, in fact, was denied to get any kind of adjunct or assistant or associate professor within UPenn. In fact, was always thought about as adjunct. She had no early career awards, but in fact, her work has developed this entire area of cancer biology and for treatments and mRNA vaccines. And so I think she's a great example of how you really just have to be persistent. But if you use traditional metrics, so measures that we think are important currently, or that people say are important, she would have failed every single one. The other person I'd like to talk about is Fred Sanger. He actually won the Nobel Prize in Chemistry twice, and he won 11 other awards. So Fred Sanger is really important to science. In fact, we talk about Sanger sequencing for genetics. But a comment was made in one of the papers regarding him that Fred Sanger would not survive today's world of science. With continuous reporting and appraisal, some committee would note that he published little of import between insulin in 1952 and his first paper on RNA sequencing in 1967. And then 10 years later, had another paper in 1977. He'd be labeled as unproductive, and his modest personal support would be denied. We no longer have a culture that allows individuals to embark on long-term, extremely risky projects. So I hope that I've shown you that in order to have impact, you don't need to meet the metrics that people traditionally have. And these are two people that have had phenomenal impact in medicine. So what's been important is that we have this narrow view of scientific impact. So if you take a look at all the things that we think about that are really important in terms of medicine and in science, what's really important is that we focus just on citations and money. So we're putting a spotlight on one single thing that we're taking a look at, when in fact, why are we not including everything that we should be taking a look at, right? Why isn't all of this not included when we talk about evaluations? And in particular, inclusion and diversity. Why are we not taking a look at all of that? And so, again, a lot of these metrics that people have used are greatly flawed. And traditional metrics are criticized for being outdated and biased measures. And these biased measures result in the devaluation of diverse scientists and their contributions. And it leads to an underrepresentation of marginalized groups in leadership positions. And so, again, if you're going to use these as metrics to promote people, to move them forward, to decide who's going to become a full professor, to decide who's become a dean. It's really important that we recognize that these measurements have actually been quite detrimental at an institutional level. And so what's also interesting is that the evidence of bias in traditional bibliometrics has been clear. And so again, just a flawed process repeatedly. And what's really important is that if you take a look at citation biases that have occurred, you take a look at the number of leadership positions and the number of physicians that people have had between men and women, that there's repeatedly times where there's biases that have occurred in what we're taking a look at. And then here, Swiss agency really didn't even like unorthodox science. And so the question is, how could you actually be novel and different if you're all going to be cited that, in fact, it wasn't really valuable? And then there were also disadvantages for the journal impact factor. So people tend to think we should use a journal impact factor. But in fact, you can see that there's lots of reasons why these are really quite biased. So impact doesn't equal publications, right? The metrics that we use do not accurately determine scientific impact. And what exactly makes a scientist impactful, and how do we measure this in science? And so if our traditional bibliometrics are not accurate, what metrics could we use? And so what you want to think about is, I try to talk about reproducibility or validity. And many of the metrics that we use are reproducible, but not valid. And it's really because we like numbers, right? As scientists, it's super easy. You have counts. It's super easy to get counts. And they're highly reproducible. But remember, being reproducible and valid are two separate things. And so just to go over it really quickly, you could be really reproducible like a bibliometric, but you could be nowhere close to the truth and therefore not valid at all, right? Or you could occasionally be valid, right? But you could have poor reproducibility and poor validity, which some of the things metrics actually have. And what we really want to aim for is good reproducibility and good validity. But that's actually really hard to get because nobody's actually taken the metric. And in general, most of them have never said, is this really a valid measure of impact? So if we just go to productivity and say number of publications, remember I told you Fred Sanger, 2 Nobel Prizes, barely published anything. In fact, I think his H index is probably less than 30. Total amount of papers published by a scientific researcher, more papers published correlates to higher academic productivity. It's quantitative, it's reproducible, but it's biased against women who are more likely to experience barriers that impact traditional measures of productivity. You could work part-time, you could focus on teaching and patient care as opposed to research. You can shoulder more family responsibilities. You might actually decide that you want to only publish 1 paper and not do multiple reviews, multiple iterations of the same type of information over and over again. And so what's important is that there are many obstacles to advancement and promotion in the work environment, and meeting a paper number is actually one of the things to do. The other thing that's interesting is the higher standards. So what was reasonable in maybe the 70s is no longer reasonable in what we expect now. And so we have to recognize that people aren't producing as much. So again, is it valid to count? Journal impact factors. So I think a lot of this is, again, it's quantitative and reproducible, but it's inaccurate predictive quality and doesn't account for skewed citation distribution. So it's important to remember that in terms of journal impact factor, what was so interesting during COVID, for example, all the kidney journals, which might have had an impact factor of 7 to 15, have suddenly gone from 15 to 30. And so how did that happen? Because all you had to do was publish a bunch of papers on COVID-19 and they got cited more, and suddenly everybody's impact factor went up. So pre-pandemic, you might have been 7. Post-pandemic, you might be 20 or 30. Like, that just doesn't make any sense at all, right? And that's purely explaining how you get skewness of the citations that get used. And the more you're cited, the better it goes. The less the bibliography on certain articles that get cited a lot, the better your citation, your impact factor. So there's lots of things that are really skewing this, and it's really important to recognize that there's limited validity for cross-discipline comparison. I look at kidney disease, Lisa might look at cognitive neurosciences, but there's so many journals out there, and it's really hard to understand what that means. There's also limitations as an accurate predictor of journal quality. What defines the numerator and the denominator? Actually, what it does is that it entices inflation practices, which I've seen directly at the journals. It doesn't account for the different citation pools that may actually occur. And then the other thing that's interesting to me is that there's lots of self-citation that happens all the time. And so really, whether you should be doing the self-citation or not, there are sometimes you have to be because you're the only person citing. But the question is, there's lots of self-citation, citation of my friends' papers, citations of only male papers. Like there's repeated studies to show these biases. What about the number of citations per publication or set of publications received? Again, it's quantitative, reproducible, but it's really related to author authority and prestige of the journal, which can significantly disadvantage junior authors. And so you have a number of published papers for the H-index by the researcher has been cited at least N times, again, quantitatively reproducible, but this really affects the junior researcher. So of course, if you've only published 20 papers, you can't have a high H-index. H-indexes only accumulate over time. So the older you are, we all look so brilliant because we're older, but in fact, it's just taken time for our papers to really get that citation. And so it's really important to think about that, and it doesn't account for varying citation levels across disciplines. And professional rank, so again, it's a qualitative measure, people moving to the next level, but really the issue is that you're less likely to recruit somebody, therefore you're less likely to bring them up through the whole promotion process. There's a glass ceiling for white women, but it's really described as a concrete ceiling for women of color and anyone from the LGBTQ plus people of color community. So what have people done? Well, really, the Dresden University Declaration of Research Assessment, the DORA principles, and the RAND Corporation have really tried to go through and say, we need to actually think, since given all these bias, that we have to refocus on what we're doing. So Dresden University talked about the advantages and disadvantages of the bibliometrics we talked about, and that we really needed to move on from there. The Declaration of Research Assessment, the DORA principles, hundreds and hundreds of academic sites have signed on to this, research institutes and universities. And it's really a set of recommendations to inform the evolvement of academic assessment. And the main theme suggests that the elimination of journal-based metrics to determine hiring, promotions, and funding decisions. And again, it's consistently saying get rid of bibliometrics, but it doesn't unfortunately propose something else that people could use. And same thing with the RAND Corporation, is that there are 100 proposed metrics to both communicate and assess the value of biomedical research, but many metrics have low reproducibility and are subject to bias. And so the question is, these principles are great. They talk about the limitations, but they haven't really taken us to the next step to say what is valid that we could potentially use. So Ellen Nugent, who's my student, who I have a picture for at the end, worked with me last summer. We did a narrative review of available literature using PubMed, Google Scholar, and broad internet search. We did this because we needed traditional and also gray literature, because there was just tons of papers that were coming out talking about all the biases. But what we wanted to do was really try and take a look at all the metrics that people have proposed, and were there any tests of validity to actually show how close to the truth they were, and then was it reproducible? And so what's important to realize is that it was actually really hard to not find a paper that wasn't just a commentary about how bad everything was. And I think that's okay, like lots of papers, everything's bad, and there's lots of bias. There's a bias against women of color, women from the LGBTQ community, persons of color, like it goes on and on. But what we were trying to do was, can we actually measure something? And does somebody come up with a metric that we could use? And so this was our inclusion criteria. And we'd taken papers just over the last 20 years. We did take everything that was in English that was available, and we didn't take papers that weren't in English, as we thought they were probably limited in application. So just so you see, we identified 1,700 papers, but in fact, as you screen things out, as you took a look and you reviewed other papers, what was interesting was we got fewer and fewer and fewer papers that were actually relevant. And so in total, we were able to take a look at 59 studies in the review, and we got 39 studies from other sources. And so in total, we were able to assess those. But what I just want to go over is that these are the typical ones that people use. And I would say that this is the typical bibliometrics that people use: professional rank, downloaded paper, peer review, number and size of grants. But you can see that actually nobody has ever measured whether they were truthful or not. Did they actually measure impact? Then when you take a look at the bias, there are many papers that describe the biases for all of these factors. So just to show you some of the things that we were doing was taking a look at the measure itself, trying to see if we could actually see if there was a paper that took a look at was it actually validated? And in fact, what was really interesting also was that we assessed things if they were an individual metric, an institutional metric, or looked at by the funding agency. And what I think is important to recognize for all of this is that almost all of them are used by individuals for promotion, by institutions to say how great you are, and also by funding agencies to decide if you're a scientist that they should potentially support. And I think that's concerning because it's you realize that we are continuously at every single step adding a biased measure to be reviewed, and you get reviewed by these different groups, and every different group uses them slightly differently. But again, never thinking, is that actually valid or not? What was interesting was that there were some other measurements that we're talking about. This mentor evaluation tool, global measure of mentorship, participation in scientific societies, a research impact framework. And what was interesting, these were some of the few that actually were reproducible, but in fact had really tried to see if you could actually test it in real life and actually see if it was valid or not. So people did try to look at these different frameworks, which I'll go over in a little bit, and try to assess if there was something that was valid. And when we take a look at them, I think the thing is that this is what I was going to say at the beginning. All metrics are flawed. All of them are flawed. And then some of them do these composite metrics. And if you're doing a composite of a whole bunch of flawed metrics, it doesn't make it any better, right? So the idea is that this is where it fundamentally is interesting to me, because as scientists, we wouldn't run an experiment with a measurement that was highly biased and flawed, right? If it lacked validity and lacked reproducibility, we wouldn't use it. And in fact, even if it was reproducible, we'd say it doesn't lack validity, so why would we measure it? And so again, as scientists, why are we actually using metrics that I think are deeply flawed? So I'm going to go over just 3 examples of ones that we found that potentially were interesting. And they're interesting because I think a lot of it tries to give you some quantitative data. One actually gives you more qualitative information, but it's really trying to measure impact. And so what I thought was interesting was that it tries to take the articles that people have. It's a quantitative measure, it's an index, and it has 3 component scores. So what did you do that was societal? What did you do from a scholarly impact, so social impact, scholarly impact, and societal impact? And the only thing is about this is that it still tries to reduce everything to a number. But I like the idea that you're now saying, how much are you doing in the public space to actually change practice, educate people, show them what's new, and have it eventually embedded into either clinical practice or scientific practice, or maybe it goes directly to public health. So at least it's trying to think about it. I'm just not sure for social impact, for example. In kidney disease, we have a ton of people that do lots of teaching using social media, and it's super impactful for fellows and trainees. But does it actually impact beyond that? That's hard to say. But I think it's getting closer to thinking about what could we do going forward. This one, the research impact framework, again, it's a qualitative metric. But what I liked was, again, that they had tested validity, and they were basically able to say, are you able to, in this qualitative measure, effectively write a synopsis of the 4 areas of what your research actually impacted? What research-related impacts did it have? What policy impacts did it have? What service impacts? And what societal impacts? So it made you think through, in a qualitative way, did you actually address all of these? Or what did you address? And can you actually explain to somebody, almost like an elevator speech, what your research actually changed? But what we recognize as we're reviewing it is that we thought it could be subject to bias by institutional influences to solely disclose only those positive impacts, right? So do we now get a publication bias because you only publish the best papers and the positive papers? And so that we have to make sure we also think about the negative papers. And then this one also was interesting. In fact, it describes the 5 domains of impact, including dissemination of science, generating awareness, catalyzing action, affecting change, and shaping the future. And I think the one for this one, it's really almost all written. None of it is actually using necessarily bibliometrics, but it's basically taking those areas to say, what have you done to disseminate in science? What awareness have you changed? What action has come out of the work that you've done? And how are you shaping the future? And I kind of like this because I feel like that's exactly why, if you follow that, that's why Katalin Karikó may get a Nobel Prize, and that's why Fred Sanger got a Nobel Prize. They had catalyzing action that really shaped the future. And I think that's the kind of area that we need to get to, and we need to be able to move forward. Before I go on, I think one of the things that's really important to note is that the DORA principles, even though universities have signed up for it, and even though everyone says in principle we believe it, the DORA actually never came out with any specific metrics to follow, that it was really principles. And so I'd say for the last 5 years, we were all signed up, but there's been nothing going forward. And so we're all waiting to see what happens. But I actually think it's going to be very hard because I think it varies from country to country a little bit, and it'll vary from different types of sciences. But I think it's really thinking through how can we actually assess the science impact framework, for example, and then how can we implement it perhaps in your area of science and perhaps differently in the institution. And so this is a slide courtesy of Kara Tannenbaum, where in Western science, typically you're trying to have this reduction paradigm. You're trying to think about studies within men. Women are considered small men. It's led by a single principal investigator with strong record of previous funding and publications, and the researchers are predominantly male. In 21st century, the hope is that we're actually doing much more complexity paradigm, where we're assessing for sex and gender and diversity and factors and doing it with intent and meaning. And then we hope to engage Indigenous and racialized groups and develop sort of multifaceted methods. And so the more we have diversity in science, I think the more we're all going to be willing to think about things a little bit differently. And then the question is, how do we measure what we're actually going to see for value? And I think it goes back to this team-based science, that instead of thinking about what are our numbers, we can really think about what's our impact and really think about the impact as much as possible. And my hope is that the researchers are now also much more diverse. And so when you think about this sort of excellent research, what Kara had proposed was, here's all the productivity metrics that we talked about. And remember, credit always goes to the lead principal investigator. They're the ones who get all the credit. You're in their lab. Whereas now if we move really to a team-based science, it's how is as important as the what, who you've included in your team, who are you supervising, how are you as a mentor, how are you doing in your team science, how is that valued? And so it's not just citations, but what's the policy change that you made? What's the societal impact that you made? And so it was interesting to see some universities, this is in Utrecht, where they're really trying to understand how can we think about this current, very sort of systematic way of doing things that we've always worked on in the individual performance with one single primary focus, to how can we actually go to something where you're thinking about how people work together in team science and how you can do a lot more work in education, research, and impact and leadership, and really hopefully change the output significantly. And so how do we move forward? I think, numbers do not equal impact. We talked about already. Focuses should be on the impact of the research. We should take a holistic approach and review of impact, talk about the communities, patients, public health. But one of the main things we need to do is, if we're going to make any changes, we almost need to be linked all the way across the board. And I don't think we need to be perfect, but what we need to do is be able to do it so we change it individually. But we need departments to also change, and institutions to be willing to change, and universities, and also funding agencies. So it isn't that it's just a couple of us that are saying, yes, these are the changes that we need to make, but in fact that we have it all the way from the individual assessment to all the way to a funding agency who says, this is what we're going to measure, and this is a sign of success. And so most recent CIHR review, I thought it was so interesting when people again talked about number of publications, talked about journal impact factor when they're assessing a scientist, and in no way really focused in on whether they had expertise in this area or not, and whether they could carry out the project that was not. So can the person actually, are they trained to do it? And if not, do they have a great team that's there to support them? And really, what's the feasibility of the project that they're doing, and what are the outcomes that'll be phenomenal? And rather than getting into these nuances of just impact factor. So I'm going to thank you here just to be able to end the show so we can really talk. Because I think so we have about 25 minutes, which I did purposely, because I think it's really important to get other people's ideas. And this is Ellen Nugent, who's my summer student who's been working on the project. And I'll just stop my slides for a second.
Well, thank you so much, Rulan. Dr. Parekh, I should say. For those of you that are online, if you can do the little emojis, it's always nice to have a little emoji. Please feel free to unmute yourself, put your hand up if you have a question or comment. I have a few, some of which you might not like. No, you'll like them all. I know you will. I think it's great. It's really eye-opening. We know, I think it's really something that you said that really struck with me is, of course, like as a scientist, we wouldn't use measures that we know are biased, but yet we're doing it all the time.
Every day. There's actually a whole book.
Oh, awesome.
Sorry, I should have shown my book, but it's called Misconceiving Merit.
Oh, nice.
And it's a PhD. So for those who are in their PhD, but it actually talks about this. And in the book, you can see every single measure and how biased it is. And you're like, okay, so if we know it's so biased, why are we
doing it? Well, it's like for me when I was still teaching, like the teaching evaluations are we know they're biased, and yet, and the university was like, yeah, we know they're biased, but we're still going to use them for tenure. And it just, it's a little upsetting. I think that I really like the Empire actually, as well as the scientific impact framework. And I think you hit the nail on the head. DORA is a fantastic initiative, but it's hard. I think there's two things going on here, and I don't just want it to be about us chatting. So please chime in, everyone. Don't feel scared. That you need that awareness, right? You need the people everyone to be aware that, hey, these measures are biased, and to embrace a new system. But it's so much easier to embrace a new system when you've got here's Empire, use this instead, right? Like even though, because it's easier for us. I'll just use me as an example. It's easier for us old people to pick up something when it's like another metric to use. But of course, that's going to be a little biased too. But I was thinking about the frameworks, and I was thinking about writing, I really like the idea of lab culture. I don't think this was in the metrics, but something from Carrie Tannenbaum's slide. Lab culture is thought of as more important than lab outputs, or is at least a part of it, right? But I was thinking, how do you evaluate that? And doesn't.
Yeah. So what's interesting is it's similar to, I think what I'd say in medicine that we're doing a lot more of, which is a 360-degree review, including patients and including healthcare providers that we collaborate with. This idea that you're getting this whole wraparound kind of review as opposed to this single itemized review. I think it depends on sort of who you are, what it's being done for, right? I think that's what we have to get back to, right? So you can think about doing these qualitative reviews, I think at very specific times for specific reasons, right? Because it's a huge amount of work.
It's a lot of work, yeah.
So for lab culture, I think if you run a great lab and you've got tons of students who keep coming to you and you've been known as a good mentor, then it's like, that should probably be used in your teaching evaluation score just as much as a teaching evaluation, right? For a single class. Why wouldn't you have it that you've actually been with people for years, and why aren't they getting to evaluate you versus just this one person that sees you for an hour once a week for a couple of weeks?
No, I agree. I totally agree with you. But I'm also thinking, you're going to get more students if you have more grants.
Right. Well, probably
you have more visibility. You know what I mean? Like it's kind of and that some of that is what else did I don't have it all up here right now, but I was just thinking a lot of those measures from the scientific impact framework and the research framework, they all took time too.
Yeah.
Even though they're all great, I think they're going to again disadvantage younger.
And I don't think we should disadvantage the younger investigators. I think we need to figure out if they have started teaching, if they've gotten some operational grants, if they've been able to leverage what they can do. it doesn't always need money to do that though, right? Like you need some money, but you don't need to have large amounts of money to be able to be an investigator, to be able to get some stuff going. And so I think I think we need to just make sure that we're not adding in more biases, that if we're going to develop something, that we better test it
Right,
and actually decide. I think that the difficulty is what you might think for your area's impact is very different to my area.
right,
And
100%.
so I think what happens is that we have to be able to, if we're going to do things at a 10,000 foot level and 100,000 foot level, we have to understand what can we actually synthesize from all of these different types of sciences and be able to piece that together. So is it that somebody works on team science, that they run an open collaborative lab, that they've got students, they've got, the way they publish, has been, their students are actually prominent in the article versus second or third or something. Like there are ways that I think we could think about it. Physics does it really interestingly. When you take a look at publications, they're all on it and they're all on it alphabetically.
Well, I was just thinking when you were saying that, I like the way NSERC does things. So CHR never likes to hear about NSERC, but NSERC, and I don't know if you've ever applied through the NSERC stream, but they first of all, it's a third of your score is the person, and they recognize already that young people will have a lower score, so they already sort of do that. Here's your
right away,
right away. And then on your CV, you have to underline all of your, and I still do this now in my own CV, is you underline all of your trainees.
Yeah.
Right away, you can see who is a trainee and where are they.
That's right.
In the order, and I really appreciate that. Plus, they make you write a thing about your training plan and the past success and EDIA and that kind of stuff as well.
I think, and it may sound crazy, like people are like, why do I need an EDI plan? Why do I need to actually, I think you actually have to consciously talk about it, right? I think you have to, in a way, it's like the land acknowledgement. You're doing a land acknowledgement because it's incredibly important and you need to first understand what you're doing, but you need to then say, well, what are the actions I'm going to have with it, right? And so similarly, what are the actions that we're going to have? So it forces people to write something.
Yeah.
What I found interesting was when people started asking for EDI plans, they would call their best friend who happened to be from one of the EDI communities. No. The goal is that you're actually supposed to figure it out yourself and figure out what you think you can do and learn about it, right?
I think that happens with SGBA too.
Similar, but I think people, but we got to force people to be like, no, you got to educate yourself, go get educated, come back and figure it out. But I think it's those kind of things, like it shows that you're a little bit more holistic as opposed to this sort of narrow view of a very traditional sort of lab. So I think as we continue to push in that direction for team science, my hope is then we give, the more we acknowledge team science, the less it'll be about the individual, right?
Yeah, I mean, absolutely. And that's the way research is going. Two things I worry about there. Let's see if I can say it without sounding like an elitist. And I don't think this will sound like elitist. It might sound like I'm a loser. And I'm saying this for all the world to hear, and it is being recorded, so this is fantastic. I've asked to be part of, like, oh, will you collaborate with me? I have this idea, or I'd like to learn more. I'd love to collaborate with you. And I've been told no more than once, and been shut out of groups. I find that interesting, and I've heard that is something that does happen to women and probably people of color more. And so that's when I'm like, well, what if you're not on the team? What if you, and then you got like Karuko, she wasn't really part of the team. She just had one or two people that believed in her, I think, right? That's my understanding. I listened to a podcast with her story on there, but I
think if you're, so it's hard because if you're systematically excluded from joining the team, do you go form your own team? Like, what do you go do to be able to be in team science? Right. I think it's naturally forming these collaborations, and forming collaborations with friends is so much easier than forming collaborations 100%. With clubs that you want to go to, right? So it's okay. I think the question is, how do we evaluate it down the road to make sure that, again, we're not biasing people So, here's this team of, let's say, 70 men, they've gone off and done really well,
Right.
and they got all this
Right.
publication. And there's a smaller team of a diverse group of people that are doing really interesting things, but have just started, and there are only 5 of them, right? So like, we're not evaluating size.
The size of the team, yeah. Like, does that make it worse, right? Like, I mean, not worse, but you can see the bias can.
Yeah, but again, you want to do impact, right? Like, I think we just want to get people to the point where we're not counting how many publications we have.
So here, I'm going to push back on that too. I totally agree. I'm just so you know, and also again, you guys speak up if you want. I totally agree with you about impact, but that also takes time to show. Right.
But you can do things, for example, there might be something that you went and presented an abstract, and then somebody's asked you to come and talk to them at their institution and implement what you just have done. That in itself may not even be published yet.
Doesn't take a long time.
And so, but it doesn't take a long time, right? So, but I do think,
I like that example. Yeah.
I think we have to really think differently. An example that was also given to me actually from somebody out in BC is that they may not publish, but they've changed how a community actually does something. And so if that community has totally transformed how they do something, isn't that impact? Or Harlan Pruden runs, actually out in Simon Fraser, runs the 2-Sprid lab. So he's changed Stats Canada approach to measuring in the next survey that goes out. Well, that's hugely impactful.
Huge,
no papers are going to come from that, but that's already changing how we're going to assess something going forward forever. That's hugely impactful.
All you have to do is meet Harlan and he's impactful.
No. I met him once, fell in love with him. I've invited him to Toronto a few times. He's great. But I learned a huge amount, because it was like, why isn't that the measure of impact? Why is it that it has to be a publication? And it won't be a publication until the data start getting collected and you can help Stats Canada analyze that data, right? So, but that's a huge impact. And why not credit that now, right?
Oh, I agree with you. I completely agree with you. I could keep going, but I'm going to make it a little quiet so that someone else.
Elizabeth has her picture on, so maybe.
Yeah, Liz, I don't know.
I always have things to say.
Good.
So I agree with a lot of it, like changing everything. When I suggest some changes, when we evaluate people, I get a fair amount of pushback in my experience. So I wonder, people will say, well, if I don't know the journal name, I can't, evaluate. I need the journal name to be able to evaluate the quality of the science. I hear that a lot. I hear a lot, I don't know anything about other activities, so I can't judge them in an applicant. This is just like, these are things are here, right? So I totally we need to change how we're evaluating people.
So,
but if you have any ways of answering those kinds of things, that would be amazing, because I hear that a lot. And sometimes I'm like, to try and to come back and response for that.
So I feel like if it's not there's maybe 20, 30 journals that you hear about, right? Like New England Journal, JAMA, Lancet, whatever. If it's not in those and it's already in the subspecialty journal, nobody's going to know the name. I don't know any of the cognitive neuroscience journals whatsoever.
Neither do
I don't know what they are. I don't know what the neuroscientist journals are. You won't know what the kidney journals are. I just think that's false. And the argument I push back now is, have you seen the impact factor for all journals? They've all gone up. So do we use the pre-cut number? That was a great number. What number would you like me to use, right? So then I'm it's so arbitrary. So what we're trying to say is people should think about where it's been published, the impact of the paper itself, what it's actually showing. And then the question is, how many people did it get out to? It's not necessarily being in a journal in JAMA is great, but maybe you got a press release and picked up by the New York Times. That may be more impactful than having a journal in Cell that month because it didn't get picked up by anybody, and maybe it's not even reproducible. So I think I keep pushing people back. It's not necessarily reproducible. So that's one thing. The second comment you made, which was there are other activities that I don't know about. I think those other activities should be written about. Like, I think we need to figure out where to put that and where does it go on your CV, right?
Well, sorry, I know you're mid, but I just want to put this out there. I was just on a call with CHR. I think I said this, and they were talking about DORA, and they were saying, oh, well, yeah, we really want to, ensure that we talk more about science communication and we evaluate that as part of our initiative. And I said, well, you're going to have to change the CCV because you asked for 5. Right? It doesn't really, and I try to jam pack as much as I can into each one of those things, but they need to change that.
It's a grants mission.
Right.
Yeah. What was really interesting to me in the most recent CHR reviews, when I was reviewing, they asked us to say whether what we ranked higher publication, blah, blah, blah. And so I was able to go back in. And then I said to them, I said, what are you going to do with my survey data? Because I want it back.
Yeah.
I want to hear back about the survey. Yeah. And I think that's the part that needs to be transparent to us, is have it come back. So from a funding agency point of view, we can see what the reviewers are doing. And then it's a matter of educating them, right? Because again, DORA principles all there. People find it really easier to say, this is an associate professor with 65 papers, H index of 60, published in the New England Journal JAMA, whatever.
Well, I've been on a number of different peer review committees, and they're all, even if the granting agency says we don't look at that, and sometimes they'll stop people from saying it, but people still do it.
But I think we have to, similar to talking about budget before you talk about science, I think when they talk about the investigator, it should be upfront. Do not give those descriptives.
Right, I agree.
Period. I think that's the kind of challenge we have to say to them, is that this just has to fundamentally change, and you can't do it. And frankly, if I was reading a grant that came from an Indigenous community, I wouldn't know how they're going to go from knowing, being, and doing, and their action of doing is very different to maybe my action of doing. How am I going to ever know what that is, right? Or understand the value and the impact? And it could be enormous, but I think all of us have to get educated in those different things, right? And if we're going to be reviewers, and people need to assess that separately and differently.
The other thing that I found kind of interesting was they were talking about DORA and trying to come up with some better metrics, which I think was going to be challenging. But and they said, so the first thing they said, and I didn't say anything out loud, and I should have, was, so we're asking all the chairs and the SOs what they want to do. And I thought, this, you just, again, and apologies to anyone that's a chair or an SO of all the committees, but they don't change those people. So those people tend to be in those roles forever and ever and ever, like years and years. And I think we need some, not dissing any of them, I'm not saying that, but we do need a diversity of thought here, because it's going to take a lot of us to try and figure out what to do. So that was kind of interesting to me, like why those people first and foremost.
Yeah.
Right.
It should really come from top.
The community, and also the community.
And the community. Yeah. I think it's I think people feel challenged in the community because the people who are the leaders, of which I showed you are more than 60-70% men, are feeling comfortable with the metrics that are already there.
Right.
So you feel like a bit of an agitator coming back and challenging them. But I think that I go back to Kathleen Carrico and Fred Sanger and say, these are scientists that have done incredibly impactful work that never met any one of those marks that we would say are important. So why is that something?
So why are people still so sad?
Why are we propagating it? And to be honest, there's a lot of publications that are crap. And I don't know why we're filling journals with a bunch of terrible papers or things that are not reproducible. And we should just be aiming for higher quality, right? Instead of quantity. And I think what's happened is because people are interested in metrics, because people look at numbers, we're driving things a certain way. And we should really pull back from that too, right? We want quality, we want things that are reproducible, we want better science, right? So if we want team science, we want it to be reproducible, we want it to be effective, we want to be impactful. So let's actually measure those kind of things, right?
100%. I mean, you're teaching the converted. I'm just pushing back.
Yeah, no, and you know what's interesting is we're actually going to do it as a debate style here at U of T. And when you're setting up as a debate, with like Elizabeth's question, with comments that you've made. We're going to put it all together as a debate style, so we can counter already those things, because we want to be able to counter all the arguments, right? To say these are the issues. Because even though like University Health Network has done a really good job looking at their current metrics and applying DORA principles to all of them, it's still a battle to get it changed. And so to get it changed, we need to change the departments, we need to change the university, and be able to do evaluation back and forth that way. So we can say everybody's going to go at once. We'll make it much, much easier.
That's great. Well, I'm looking forward to that debate. I gotta get on that invite list, because I want to.
Yeah. Well, right now it's just with the department chairs at U of T Med School, but once we've done that, then I think we should go public.
Yeah, you should go public, I think, because again, diversity breeds discovery. One of my very favorite phrases to say, and listening to other diverse ideas about what to do, I think could be really interesting.
Yeah. Think about what we could do, right?
Yeah, lots of accolades. Thanks, Liz. She had to go. Somebody else, I got a private message too about they had to leave early, but they wanted to thank me for what I'm doing, but I think they meant you. Thank you for what you're doing, and let you know that I took away many key points that I hope to think about more in the future. Yeah, I think it's really thought-provoking, and of course I like the Empire one more, because I was like, yes, it's a number.
It's a number.
I think, not just too biased about numbers.
I think we can, yeah. Well, we like numbers because we're scientists, but I think you're gonna have to get away from the numbers.
Yeah, I think so too. Yeah. And what it also made me think of in the last 1 minute, the CIHR external reporting. Like, so once you finish your grant, for those of you that don't know, you have to write this external reports, usually like a few years later. And I don't know, I find it's biased in another direction. It's all about impact to medical services, which not all of us do research in that field. So I find that.
Yeah, that's right. And so I think it's, and it shouldn't be all cookie cutter, right? So the idea is that it isn't all to medical care. So we have to reframe how all of that gets done. And in fact, I think there's a number of things you and I are going to talk about in a couple of months about all the things that CIHR should do. But one of the things is sort of, possibly changing that whole follow-up framework, right? So
that sounds great. Well, thank you so much for your time. We really appreciate it.
Thank you so much. Thanks so much. Take care. Okay. Bye.
Bye, everyone.
Bye.
Thank you.